Well, thank you very much for that long introduction, and I'm very
I didn't write it.
very embarrassed really to be here to acknowledge that. But thank you very much indeed. I hope that those that were listening this morning at 7 o'clock, I didn't disturb their breakfast too much. I hope that I'm not going to disturb your dinner that much tonight. But I am going to talk about things that have happened over the last 5 years. And as I showed people this morning, 5 years ago, 2011, I was actually working for Médecins Sans Frontières in Misrata in Libya. And I don't know if we can turn these lights down a little bit. And I went on a boat to Libya, Misrata, training, teaching the local surgeons there and dealing with all the injuries that occurred in Misrata. I've worked with MSF for many, many years, and in 2012 I was asked to go to Syria, and I went up to the one of the northern hospitals just south of Reyhanli and worked in a little hospital called Atme, which was just over the border. But it was different. As I said this morning, it was very different because there was something in the air which wasn't like what it was before. And just crossing the border, you can see Turkey is on one side, and we just walked over the border into Syria. You could do that then. And this was our project manager. And as I was taking a picture of him, we heard this rumble of a helicopter coming over the hill. And I thought, this is very unusual. Maybe it's a Turkish helicopter. It was very close to the border. And as the helicopter was coming over the border there, and we looked around into the little village that we were going to be working in, called Atme, and we all looked at this helicopter wondering what it was going to do. And it just started firing rockets into the little town of Atme, blowing up the village and blowing up and destroying civilians. And it was a real shock to feel that just close by, though, this was all happening. And MSF were quite amazing. One of the entrepreneurs in this little village was actually a very famous Syrian surgeon himself, an ENT surgeon. And his father had this house opposite the road. So MSF got this house, and they created it into a hospital, and lower ground floor was an emergency department, and a dining room became the operating theatre, and upstairs there was where the ward where the patients were, and we used to sleep on the top. And patients would come through, many patients would come through with severe injuries into our little emergency department, and then would be treated as we did in the dining room, which was converted into an operating theatre, and we did as many cases as we possibly could. And the patients went upstairs then to our ward, and we did lots and lots of surgery. And when I came back, I'd established this course at the Royal College of Surgeons called Surgical Training for the Austere Environment course, and I invited many surgeons who were working in the UK at the time, who were Syrian surgeons. I said to them, I think that this crisis is going to go on, and you should come on my course, really. So they did, and about 7 British Syrian surgeons came on my surgical training for the austere environment course, which I run at the Royal College of Surgeons, training at least 30 surgeons every 3 times a year. And we train surgeons such that if you don't really know what to do, then we'll give you as much information as we possibly can for you to be there, and we'll give you information as well of how to cope with the casualties you'll see. And the course runs from Monday to Friday, and basically it goes through everything from top to bottom. It goes through chest surgery, abdominal surgery, orthopedics, plastics, the whole works really. And so I decided then with one of the Syrian surgeons that I wanted to work, who was on this course, I said, can I go with you with Syria Relief and OSAM into Syria rather than with MSF, because I'd like to see what it's like to work with another agency. And we did, and we went to, I went to work, first of all, over the border in Bab el-Hawa Hospital, the same hospital which has talked to us, Anas has talked to us about this evening. And it's a fantastic hospital, but there were lots of really bad injuries in children which we dealt with, But I decided also to try and teach as many of the surgeons in Bab el Hawa the techniques that I was teaching back in London. And we do lots of plastics, we rotate lots of muscle flaps to cover various bones. But Munir, who is the Vice President of Syria Relief, was on my course in London, and he came to join me after 4 days, and we went into Aleppo. And you've just seen a picture on the film about this little hospital where I worked in. And as I was telling you this morning and yesterday at McMaster, when you're in a war zone, the most senior surgeons tend to leave first because they've got their wives and family to look after. They don't want to be there and with their families in a terrible situation. So they leave, and then what you're left with is very young junior surgeons who need the skills to be able to operate and train and teach the patients that are coming in. So here's our group of surgeons that were in one of the hospitals where I was working in the centre of Aleppo. You can see how young they are. The oldest is about 28, and the amount of serious injuries that they were dealing with was quite phenomenal. This was the accident in the emergency department, and lots of gunshot wounds were coming in. Very serious, difficult gunshot wounds. So every evening we would have lectures about how to deal with all these very serious injuries. And I'm not going to show you the gory pictures of this morning, but I want to tell you about this patient who was really the defining moment in all this sort of surgery, which really made me realise that this surgery was not surgery which you could deal with a 28-year-old that's not done very much surgery before. This is really serious stuff, and they really need to be trained, and they really need to know how to do it, because if they're going to save lives in Syria, you're going to really have to know how to do this. And this man came in who had a fragmentation injury due to an airstrike, and you could see his heart was stopping, he had no blood pressure. And in fact, what had happened was a fragment had gone into his chest and opened up into his heart and had caused the right ventricle, the big ventricle, one of the beating chambers of the heart, to bleed. And it bled into the sac called a cardiac tamponade, and he was dying of this, and you needed to relieve the pressure. Once you've done that, you needed to be able to put a stitch in the heart to get over the operations and to make him better again. And so I showed them how to do this, and this was almost a revelation that, okay, we can do this, let's just try and do it. And we had so many sniper wounds in 2013 that we had so many patients not to practice on, but the patients to deal with. And hopefully I could stand back at the end of the day and they could do their surgery. And this little boy survived very well, and it was a great relief to see that. And so I spent a long time in Aleppo teaching all the surgeons, and there I am here with them all surrounding me, watching how to do the various operations. This was again a survivor of a huge operation that we did, and I think most of you heard the operation this morning. And it was a great upset to actually leave, but we left, and we left really with a legacy, because we showed them how to do plastic surgery, and this is them sending me images of when I was at home, how they're coping with the injuries, and we became great friends, and we were able to transfer messages backwards and forwards over the last few months. And one of the biggest legacies I think we had was a great WhatsApp from my friend Abu Abdullah, I trained there, who was able to operate on somebody, open up their chest, deal with a fragmentation wound and a gunshot wound to this boy's heart, and there he is surviving a week later. And not only does it give the doctors there the joy of being able to do things, they can actually feel proud that their patients are surviving and they can do a good job. Now, when you do come back, you try and give the situation that's on the ground. You try and tell people, it's really, really bad. And many times I'd be on the radio at home, telling them really what it was like working in these sort of environments. And I gave this is a BBC radio interview called PM, and 5 million people listen to it in the UK every day. And I gave this chap who's called Eddie Mayer, who's a journalist, what it was like working in this secret Syrian hospital. And it was over Christmas and December the 31st, 2013. And there was an artist who listened to this and was so taken, as were, and I was just telling them, the readers or the listeners, really what it was like working there. And people were absolutely stunned. They didn't realize really that, that this is going on, because there are no journalists there. Nobody's reporting on it. And this is an artist, and his name is Bob and Roberta Smith. He's got a silly name. But he actually made this, he actually listened to this conversation that I had with this journalist, and he actually made it into an enormous transcript. And this was held in the Royal Academy of Arts and was put up there. And there's a bit in the middle, which you can see there's a complete gap. And the complete gap was this. I was telling the journalist what it was like when a patient would come in and he would be bleeding to death. And you'd open up the abdomen or you'd open up the chest and there'd be blood pouring on the floor. And then you'd have to work out how much blood you had in the fridge and so on and so forth. And he said to me, well, what is it like? I said, well, it's actually like working in an abattoir. And he completely went silent and just stopped talking. And that gap there in the middle is that gap where he is stunned into silence. And I'm glad it happened, because I'm glad that people suddenly started realizing that the amount of surgery and the amount of difficult surgery that is going on in these hospitals people need to know about it. And in 2014, I went back again with Syria Relief, and the situation, as you saw from the video, was completely different to what it was in 2013. There you can see the ISIS-controlled areas. Here I am in Bab el-Hawa, doing again a lot of plastic rotational surgery, and then en route then to Aleppo. And you can see all the devastation of Aleppo with the barrel bombs that were being dropped all the time. And there's myself and Ammar, who always comes with me on my trips, looking at the devastation. And as I think you saw this morning, on this same walk, when we were walking around, there was a Syrian jet that circled around Aleppo, and we thought it wasn't going to, and it came lower and lower and lower, and was about 500 feet above us, circled round again, and we thought that's it. And in fact, we could see the Syrian jet coming towards us, firing rockets. So, here was us dressed as doctors in surgical suits being fired at by planes in the air. Not only that, there's, as you know, lots of barrel bombs being dropped. And this is a picture I took of a helicopter dropping a barrel bomb. And this is a sort of devastating effect of the smoke and the cement and everything that arrives from a barrel bomb. Not only that, as we've heard, hospitals are being attacked all the time. And this was a hospital I worked in 2013. This is what it was like now. And so we worked underground in one of the hospitals, and just for safety alone. Again, in 2014, I spent a lot of the time teaching and training, but it was an absolute joy. It was a completely different ball game to what it was like in 2013, because this 28-year-old surgeon had become a fantastic vascular surgeon. So here I am now just watching him operating, mentoring him and advising him if he needed any help. And it was an absolute joy to see how the training and teaching that you could give people, surgeons, does actually work. And here I am again mentoring, watching them doing their operation, just giving them some advice rather than getting my hands dirty as well. And again, here it is again. But the devastating effect was really bad, because here you can see what it was like in our hospital, and occasionally this would be filled with dead bodies from barrel bomb attacks. I'm not going to show you that picture, it's very unpleasant. What I am going to show you though is something which I think, as a humanitarian and as a surgeon and as all of us, we can do. And I'm going to tell you a story about this little boy. So this is a 4-year-old little boy that was involved in a barrel bomb injury. looks a terrible injury, and it is a terrible injury. He's lost he's there lying on the operating table, he's scared, his mother isn't around, he doesn't know what's going on, he's lost all the blood supply to his foot, he's got no blood supply to it, it's happened about an hour before he came in. He's going to, what are we going to do about him? Well, the easy option is this. The easy option is to take a knife and to just cut his leg off. That's the easy option. But we're not going to get beaten by the person that's doing all this sort of work, this harm to everybody. Let's really try and save him. So what we did was this. This looks a bit gory, but it's not as gory as I showed this morning. But what we did, you can see here, we took the vein out of this leg and we made it into an artery. We put the artery from the top there and we anastomosed it, that's joined it up to an artery down the bottom. And with this dead skin, we cut it all off like this. We put this thing called an external fixator in his leg. And then we did this operation called a cross-leg flap. So you cover this part of the tissue by taking the skin and from the other leg, and you cross it over onto this leg. So there's the flap there, and you cross it over. So this leg flap gets joined onto the other leg, so that in the end, this leg will start to provide circulation to the flap. So after about 3 weeks or so, you can actually cut it. And so this little boy then spent 3 weeks in our little hospital in this situation with external fixators binding his legs together. And we were determined that the perpetrator of this injury wasn't going to work. And after 3 weeks, we cut it down there, and lo and behold, it worked. And he is called Hope. He's the hope of what we can do, what surgery can do, what you can all do. We're not going to get beaten by what's going on in Syria. This is hope. We're going to continue and continue and continue the humanitarian work so that we can provide hope. This year I worked on the Turkish-Syrian border in a small hospital called ML Hospital, again with Ammar, who came with me. And again we spent time doing lots of musculocutaneous flaps to cover injuries. And we taught as many surgeons as we possibly could then. But one of the things I have done is, there's my wife in the middle, Ellie. And what we have done is we created this foundation whereby we now we're trying to get as much money as we possibly can to allow surgeons to come across to the UK so we can train them from all over the world, not just Syria, from Africa, Middle East, wherever. And we've set up this foundation. Not only have we set up this foundation which allows surgeons to come to the UK to get trained, but we've also been able to set up this foundation with the Royal College of Surgeons, who have given us ratification and given us certified that we can use this hostile environment surgical training to take this course and to try and train as many surgeons as we possibly can. So wonderfully, we took this course to Gaziantep in Turkey in April with OSAM, Syrian British Medical Society, Syria Relief, my foundation. We went to Sanko University, who offered us a big place where we could go and teach 30 Syrian surgeons that came from inside Syria. They came from Hama, Homs, Idlib, Aleppo. They came across the border, and we spent 3 days with them, and we taught them as much surgery as we possibly could. And they discussed their cases with us. We discussed our cases, how we would do things. And this is the way forward. This is the way to keep it all going. And not only that, the training and everything else that goes with it creates friendship, it creates harmony, and we all become friends and people talk to each other. And the other day I received a WhatsApp from somebody at a dinner about, in the middle of a dinner, how do I deal with a gunshot wound here, David? And I was texting underneath the table. And This is the group of surgeons that came from up from Syria with our faculty, and Anas is there somewhere. I can't see him, but and the beauty of it is, here I am in Aleppo in 2013 with Abu Abdullah, and here I am in 2016 giving him his certificate for coming on this course, and we're still all great friends. But as we know, one of the big issues at the moment is healthcare in danger, hospitals being attacked. And I went to Geneva with OSAM for a meeting just before, in December 2015, because we knew that hospitals were being attacked all the time. So we had this meeting in Geneva, how to do something about it. And of course, these meetings don't do anything. They don't do anything. Nobody listens to you. Politicians don't listen to you. Nobody listens to you. It carries on, and it carries on, and it carries on. And this is my friend in Aleppo, who recently, I was so worried about them. I was so worried about what was going on that my heart was bleeding sitting at home. I couldn't stand it. And this is his WhatsApp, which you can read. So we decided in London that enough was enough. So I got on the phone to a friend of mine and said, right, we're going to have to do something about this. We're going to have to go on a march. And I've never done a march before. I've never been an activist. I've never done anything like this. But the medical students in parts of where I used to go around lecturing, I told them all, come on, let's all get together. Let's go for a march. Let's flag this up, that we can't stand it anymore, that medics mustn't be under fire. So what day was it? May, so a few weeks ago, we went on this march in London from Trafalgar Square. I stood up and gave this speech, and so did 7 or 8 other people. People from OSAM and were there to give their remarks about it as well. And this is Ammar's son, a future war surgeon, saying, stop me becoming the next target. This is me speaking in Trafalgar Square saying, stop killing doctors, stop attacking hospitals. This is my daughter. And this is what I've often said. Healthcare is seen as a weapon. You take out a doctor, you take out 10,000 people that they can't care for. We went to the gates of 10 Downing Street. We stood there. I stood there with a policeman arguing the point of view that I need to go and see the Prime Minister. And he told me to go away. I'm not going away. And he said, well, come back in a week or so's time. So I did. And I came back with this letter to the Prime Minister to say, look, you've got to do something. And I also think that Canada has to do something too. We all have to do something now to stop this occurring. And we're having some discussions over the next few days about how to do that from the Canadian point of view, because your voice is really, really important. I don't think the British Prime Minister is doing anything at all. I think they're all running away from the issue. It needs perhaps another government to try and do something, and maybe your Canadian government may be the right way forward. Here's all my friends that I miss. That's my wife, and that's the biggest torture I have at the moment, my daughter. Thank you very much. Thank you very much.